To develop competence in the role of scholar, I think it's very important to help residents understand how to critically appraise the literature, how to self-reflect and look at their own practice, um, and how to and to create an environment in which they feel comfortable in challenging. So it's very important that if you're going to ask them to think outside the box and to challenge what you do as a staff doctor, for example, they have to be comfortable doing that. So you have to create an atmosphere of trust. Ideally, you create some relationship with residents, which is getting more difficult in today's world as we have shorter rotations with them. But I think establishing relationships with them is important so they can trust you. And then it's to evaluate what they say to you in a non-judgmental way. So you have to challenge them to inquire, but no matter what they say and how crazy it might be, to not take it personally and not think it's stupid, unintelligent. It's every single idea that is challenging what you do has potential use. So when they come and they say to me, let's say we have a case that requires bridging therapy with heparin because they're on an oral anticoagulant. And I'll say, well, what do you want to do? How are you going to manage this patient's anticoagulation when we have to stop it for their surgery? And many times they'll sort of want to just tell me what they were taught before or what they read on Up to Date or what is simple and makes sense. And what I'll say to them is, well, why not use this dose? Or what is the evidence that you need to use this beforehand? So you have to challenge them around the things that they want to do to make sure they've thought about all angles in treatment or diagnosis or whatever it would be that the situation is that you're working with them on. Another thing that's important to do to residents is make the environment that they're in fun. Make the learning environment fun. So when we're in clinic, we laugh, we joke around, we talk openly about all sorts of different topics. We get coffees, we joke about who has to go get it. We all try and work at the same level. We try and eliminate the hierarchy of the trainee versus the faculty. And I think that really creates a trusting and open environment for residents to learn in.